everyone, my name is Kelsey Harding. I'm from the class of E 2016, and I'm going to be giving the AOA talk on family medicine. So this is an overview of what I will cover. I'm going to talk about why I chose family medicine, what the scope of practice is, what the fellowship opportunities are. I'm going to cover some of the family medicine specifics in terms of career. I'll talk about fourth-year electives, a timeline to the path of family medicine, and then cover letters of recommendation, how to be competitive, and if you guys have other questions, I'll give you resources and contact information so you know how to reach out. So I chose family medicine because of many reasons. One of the big ones is the breadth of practice. I'm interested in rural medicine, so breadth is something that I love. I love the idea of being able to do kind of a variety of things with a huge population. I also love that family medicine offers a really unique longitudinal patient relationship. Some of my attendings had patients for over 40 years and knew all of their kids and their grandkids, and I think that's really unique, and it seems really satisfying. I also love that there's a huge component of counseling and psychiatry in family medicine. Part of that is because of our lack of access to mental health resources, and part of it is just because that's kind of what family medicine is for, and I find that really enjoyable. If you don't, then it's something to think about. Family medicine also has a really procedural attitude in it, so I like procedures, and I like that family medicine does a lot of them. And then lastly, I've noticed a lot of the attendings and a lot of the community leaders that I work with within family medicine all have this kind of attitude of a mission for serving the underserved and of being community leaders. And that's something that's really important to me, and I see myself going in that direction. So it's something that really attracted me to family medicine. So it's a busy slide because I think, in my opinion, that family medicine has the broadest scope out of all specialties. In terms of setting, you can be outpatient, inpatient, you can be in the ED, and you can do urgent care. I know docs who are only outpatient. I know docs who are hospitalists. And if you live in a small enough area like Chelan, Washington, you staff the ED. Urgent care is much more common. You can kind of mix that in with your practice. So people do a variety of things. You can also do a mixture of outpatient, inpatient, urgent care. You know, you can have a whole mixture of that. In terms of population, family docs see everyone. We see adults from 18 years old to 110. We see them for preventative wellness visits for acute illness, chronic disease. On the pediatric side, we see neonates, all the way up to 17. We do the annual well child checks. We do a lot of parent counseling, and we see acute illness, and we manage chronic diseases as well. For OB, family docs do a lot of reproductive health, from counseling to birth control to termination to helping, young couples with a new pregnancy. We do all the prenatal care, and we can do vaginal and cesarean deliveries. And then, of course, we take care of women after they've given birth. Within family medicine, you can also take care of, quote, special populations, people who have HIV, people who are transgender or part of the LGBTQ population, or people who struggle with addiction. It kind of depends on what population you serve and what population you get trained at in residency, but these are all definitely possible. And then here is a not comprehensive, but a pretty extensive list of procedures that family medicine docs do. This includes, all the skin stuff, biopsies, laceration repair, nail removal, female reproduction, including Nexplanons, IUDs, colposcopy, pap smears, pregnancy termination, joint injections, aspirations, circumcisions, ultrasound screening, like AAAs, But you could also use ultrasound for injection, like ultrasound guided injection in sports medicine, or you could do bedside ultrasound just to look for like gallstones or something like that. On the inpatient side, you can be trained to do paracenteses, thoracenteses, lumbar punctures, and central lines and other lines. And then the last four are a little more specialized, and you would have to really focus to get training in residency, but you can do vasectomies, exercise EKGs, conscious sedation, and upper and lower endoscopies. So a very broad spectrum. And here is a list of all of the fellowship opportunities that is offered to family medicine. I found these on the AAFP website for registering for family medicine fellowships. I obviously don't know about all of them, but I can tell you, obstetrics, addiction medicine, sports medicine, palliative care, and geriatrics are really, really common. And I think most of them are about a year, if I'm correct. Lots of different options, though. For family medicine specifics, so for training, you go to residency for 3 to 4 years. Most programs are 3 years. There are a couple of 4-year programs that are kind of piloting what that curriculum would look like. But I would say the majority of programs are 3 years, and you don't have to do a 4-year program. More isn't necessarily better. You match along with most other people through the traditional match, meaning you use the ERAS and RMP system that I will talk a little bit more about later. For salary, I went on Medscape. They did a survey of family docs, and they found that the average salary in the U.S. was $230,000 in 2019. That obviously depends on what your practice looks like. If you have a more procedural practice, or if you are doing sports medicine or deliveries with OB, you're going to have a little bit more of a higher income than if you're doing only outpatient primary care to like an adult population. The Googleable salary ranged from like $170 to $280, so that's what you make of it. For the average week, I also found this report on Medscape that said the average week was about 40 to 60 hours a week. That's at full time. And then they actually broke it down to an average of 35 hours seeing patients and then 10 to 19 hours for doing paperwork. If you didn't know, family medicine has a lot of paperwork involved, and it's something to be aware of before you decide that's what you want to do. So let's talk about electives to take during your 4th year. For family medicine, there are no specific required electives. I know for emergency medicine, they require you to do an away rotation. There's nothing like that for family medicine, though I believe our family medicine department does require you to do a family medicine sub-I. It's also recommended to do a sub-I because you can, beef up your 3rd year clerkship grade. You could get a letter of recommendation. If you're waffling between family medicine or something else, it can help you confirm whether or not you're interested. And then some people use sub-Is as a good way to check out different programs. So I know one of my classmates, she did like an urban and a rural family medicine sub-I to kind of compare what those 2 programs looked at like. One of my other friends had 2 programs that she was considering, and she did sub-Is at both of them, and it really helped her decide between programs at the end. So for people going into family medicine, there are different ways to approach the MS4 year. Like I was saying, some people use sub-Is to check out different programs, so you could just do a ton of sub-Is at programs you think you're interested at. I know some people use rotations to gain skills or improve weak areas. So for my class, I thought that MSK was kind of a weakness, and so I signed up for a sports medicine orthopedics rotation to kind of improve my exposure in that area. And then the other option is to do rotations on specialties that you'll never see again. So for my neuro rotation that I had to do, I ranked neurosurgery higher because I'm never going to see neurosurgery again. And it was really interesting and really informative. So for letters of recommendation, most programs want at least one family medicine letter. But this can be any family doc from any rotation. It doesn't have to be, at the academic setting. It can be in the community, anyone who has been with you on rotation. All of the other letters can come from any other specialty. I think they all kind of contribute towards family medicine. Most of the programs that I applied to wanted somewhere between 2 or 3 letters, and I submitted, 3 to 4 letters. I think that asking 4 different people for letters is a good kind of safe area, because in case one person forgets or doesn't submit on time or whatever, then at least you have kind of the other 3, so it gives you a buffer. And then there's no departmental letter required. I know other specialties like OB have to do that, and it sounds like a hassle, but you don't have to do that for family medicine. Okay, so here is a general timeline that's really helpful for most people, besides those going into family medicine. But when you start medical school, I really recommend getting involved in some kind of extracurricular activity, whether or not it's volunteer work or belonging to an interest group. And it doesn't have to be family medicine interest group. It can be any of the interest groups, really, because I think that they all are applicable to family medicine. But also it's more to get you involved in something else outside of medicine, both for your mental health and also to help cultivate things that you're passionate about. And then, as you get more comfortable being in medical school and you move towards your MS2 year, taking on leadership roles is something I would recommend doing. During your MS2 year, kind of around February to March, you'll take step 1. And that's historically been less emphasized in family medicine. I think it's still important to pass on the first round. And like any specialty, the higher score you get, the better your application looks in general. But there's no minimum score to be competitive in family medicine. They did just recently change things to pass-fail, but I don't know when that'll go into effect. So when you start your MS3 year, you start all of your clinical rotations. I think, everyone should go in with the attitude that all of the rotations matter. Doing well, as well as you can on all the rotations, working hard, learning the skills that you can from each rotation, I think is really important. And so you should go towards each rotation, intending to try your best. I would also say, think about letters early. I know it's kind of hard when you first start rotations to think about other stuff besides trying to survive. At least that's what my mindset was. But if you have a rotation, early on in your 3rd year and you feel like you really connect with an attending, or you just had a really good rotation, asking them for a letter is a good idea. Because then you could follow up with that and end up using it. And then I just want to say that it's okay if you don't honors in family medicine. It's not, the end of all things. You always have the opportunity to try to honors in a sub-I. But also it's just, as long as you have good comments and as long as you tried your hardest, it's not a big deal if you didn't get an honors. So at the end of your 3rd year, you'll start thinking about building your 4th year. And sometime between like April to July is when you probably want to take a sub-I. Taking a sub-I earlier will help you to get letters if you still need letters to get. It will help you to decide whether or not family medicine really is for you. Whereas if you wanted to do a sub-I later in the season, July, September, August, October, those grades aren't going to go on your dean's letter as easily, so they won't make it onto your application, and it'll be too late to get a letter, but that can still be a good time to investigate programs that you're interested in, and it'll be a time when interviews will be getting near, and so those programs will have you fresh on their mind, so that's a strategy that you might employ. ERAS open in the beginning of MS4 year. I want to say it's like June-ish. But you'll want to start your personal statement a little bit earlier than that, so that you can kind of work on it all summer, and it'll be ready to submit when the ERAS are due, usually around mid-September. Interviews. So for family medicine, interview invitations tend to come much earlier than other specialties. I know other specialties say like, oh, you won't hear back until October 1st, or you won't hear until like November. For family medicine, the interviews can be sent out as early as that first day. So I did get an interview invitation on the first day of ERAS submission. But then I also had a few programs who weren't sending out invitations until later in the season, until like October. So you can have like a wide range of when you get interviews, but I think it's just important to know and to be ready for interviews to roll in early. Or an interview season itself, you usually start in about mid-October, and I think it can go as late as mid-January, but I would say most students are done interviewing around mid-December, unless you're like dual applying or applying late or something like that. And the number of interviews that you want, I think, is really depends on your own specific application, and so that's something that you would ask Family Medicine Advising about. So the NRMP is the rank list, and that is due at the end of February during your fourth year. And I think universally I've heard the advice that you really should rank all of the programs that you interviewed at, unless you would absolutely rather not rank than go to a certain program, which I guess that could be possible. But so you submit that rank list, and then in mid-March you match. Our match day is 10 days away, and it's very exciting, kind of hard to wait for. And then after that, you start residency in about mid to late June, and then you would do a fellowship after that, and then you would be finally an attending physician. So that's kind of what the whole timeline looks like. So how to make yourself competitive in family medicine. So I think that a lot of the advice that I'm going to give is pretty generic advice, because family medicine is not an ultra competitive specialty, but you still need to do all of the things that you would want to do to be a good applicant. So I think some of the things that make you more competitive in family medicine are things that show off your interest, your passion, or your commitment to family medicine. So taking advantage of extracurricular opportunities during the first and second year so that you would have something that you've worked on longitudinally can be really important. FMIG, especially within Seattle, has a huge department. There are two FMIG advisors who kind of serve as a longitudinal overseers, and they help to kind of keep the projects going, but it allows you to step in and help out and take on a project and learn and grow and grow the project itself without having to entirely recreate things. That being said, there's also the resources to create your own projects. So I can't speak highly enough about joining FMIG. If you're outside of Seattle, I can't speak to what those interest groups are like, but I know that they exist and they're pretty active. And if you wanted to create projects or create things that are not currently there, I know that the one in Seattle would be happy to support in any way. So it's definitely possible. And then I've already said this, but growing into leadership roles is, I think, a way to make yourself more competitive. It's one thing to be a part of a certain, event, but it's another thing to actually lead it and plan it and organize it. I'm kind of reiterating this, but, finding something you're passionate about and sticking with it throughout medical school. So it can be anything, but sticking with it, I think, just shows commitment. And so that's really important. And then in general, you want to do well on third year rotations. You want to, not fail any rotations. You want to aim for that honors high pass. And you want to have good comments, so working hard, being kind, being a team player, those are all important things that reflect on how you will be as a resident. And then I think it's really important to pass step one the first go around. If you don't pass the first time, I don't think that precludes you from applying to family medicine. But if you pass the first time and then, as your step score gets higher, people do notice those things. So here are some helpful resources in case you have more questions. I think one of the biggest one is your college mentor. That's what they're there for. They are usually happy to answer any questions or concerns you have about grades or specialty choice or anything. And then for questions more about family medicine, applying, matching into family medicine, you can always reach out to other students who are already matched. And I know you could probably get connected to those students, either through your college mentor or through AOA. And a lot of us would be happy to answer questions, either, through email or Skype or whatever. There are also the FMIG and family medicine advisors who you could reach out to by email. They're happy to answer questions. And then there's a website that they have that is a fantastic website, especially for drafting personal statements and getting ready for interviews. They have a lot of practice questions that you could go through, a lot of personal statement prompts that you can think about. I used that website a million times when I was applying to family medicine. And then these two last two online resources, I didn't use all that much, but I know they were there. The AAMC has a whole tab committed to helping you decide between specialties. And then the AAFP has more articles and videos about applying to family medicine, interview tips, and then what an actual family medicine practice looks like. If you have more questions, this is the email for the Department of Family Medicine Advising, famed@uw.edu. And I know they would be happy for you to reach out and ask them any questions. All right, I hope you guys have a good day and good luck in your path towards family medicine.